We're talking dentistry this morning with Dr. Amma from the Dental Spa. Hello and welcome back, Dr. Amma.
Hi, Suzanne. It's always good to be here.
Great to have you here in the chair. We're going to be taking a look at some innovations. We've got Arab Health this week. It's running as we speak. So there has been some talk there about 3D printing when it comes to dentistry. So we'll be having a look at that in a little while. Also, some of the developments when it comes to research, including this story I picked up on, Dr. Amma, when it comes to the idea that we might not need to have certain treatments when it comes to our health of our mouth and the dental care. So things like the dentist drill. Now, I know that you are that's gone from your surgery, I think. You've talked about this before. But let me tell you about this. Decline of the dentist drill, a drug that helps rotten teeth regenerate. There are trials happening for this, so need for fillings could be reduced in the future as the study reveals a natural ability of teeth to repair themselves, and they could be enhanced using an Alzheimer's drug. Are you familiar with this, Dr. Amma?
Yeah, it's still under research, very early days. It's in lab mice still stage. It's very good news. It's very good news, but I don't want it to be put out of context. When and if it's available for human use, it would be really good, especially for fearful patients. But on the other hand, it would not be a repair for all. The use of it would be in limited cases of caries, not the extensive damage of teeth. But it's, of course, very good news.
So, just so I've got it right, the therapy works by, like it's stem cells, so enhancing the natural ability of the teeth
the natural
to repair
structure
themselves.
of tooth, yes, the natural structure, but on a certain layer so far of, because teeth are like onions, there are too many different layers, and so far it's been very effective on, again, in laboratory tests on mice, on a certain layer of the teeth, not the full structure. So this is why I'm saying it's very good news, but it would be when it's available for a limited use.
Arab Health is running this week and looking at the Dubai Health Authority, many different initiatives being discussed this week, but they are showcasing the latest medical services and applications at the Arab Health Congress. And on their list, Dr. Amma, is 3D printing technology. DHA are going to be discussing in detail the progress in implementing 3D printing technology into DHA's dental clinics during the 4-day Congress. So enlighten us a little bit about 3D printing and how this might work or how we might benefit from such a technology in the dentist.
I love that topic. It's the future of prosthetics in general. Not only dental, but any prosthetic in the human body nowadays. We can recreate shape and function through actually building a body part. Let that be a joint, a part of a joint, a bone, or in the dental case, all the crowns and the fillings and the restorations could be done on the spot within an hour without the necessary wait of weeks for crowns to be made or for an inlay or an onlay to be made. It takes from 20 minutes to 1 hour max, and everything is done to a natural state to a T. It looks exactly like a tooth structure. It functions exactly like a tooth structure within 20 minutes.
Incredible. Just things like, having a retainer, braces, that can all be done in one appointment, where normally you take a fitting, you have to wait, get fitted a few weeks later.
And it's good that you mentioned that as well. So even the molds nowadays, we take it digitally, so there's no dough that goes inside the mouth, because a lot of people hate the dough that goes inside the mouth during the impression taking. Nowadays, we take it with a camera. Very small pin-like probe that goes inside the mouth, and it takes a 3D picture, and that's the mold. It's all virtual. So it's the future of dentistry, and it's definitely the future of prosthetic medicine.
We're going to explore more what's new and what's being developed in this area and debunking some myths, as we always like to do with Dr. Amma, and taking your questions. So questions are coming in. Let's address a few of them now. Emma's asking, should I floss before or after brushing my teeth? Now, she says this might be a silly question. I don't think it is a silly question.
There is no question that is silly at all. Thank you for asking this. It's a very smart question, and yes, you can floss before or after. I personally, it's not a medical thing, but I personally like to floss before flossing. Floss before brushing. It just makes me feel better. But you can floss before or after, whatever is easier for you.
And flossing, on that note, you're flossing how many times a day?
Ideally, you need to floss after every time you eat, a minimum of once a day.
Okay, and what do you recommend to floss with?
Always use the wax tape. Don't use the thread, use the wax tape.
And avoid the sticks or the wires?
Of course, the toothpicks,
the
yes.
little brushes.
Toothpicks, avoid toothpicks, please, yes. No, the interdental brushes have their use in certain gum disease cases. But for general use, please use your wax tape floss.
And Dr. Amma joins me this hour. He's a cosmetic, laser and family dentist based at the Dental Spa on the Beach Road. We were just talking there, mentioning about flossing, and James has come back on our message system with a question about that. So we're going to get back to that. Also, questions about 3D printing as well, being used in dental practices. Now, Dr. Amma, coming back on flossing, and you were recommending at least once a day.
Yeah,
at least once a day. It doesn't matter whether you do it before or after eating. And James has come back and said, I thought there was research out there recently, actually, that it's saying that it was a waste of time flossing and that there was no proven evidence that it would make a difference. So, James, we just quickly pulled that story from the BBC. Should you floss or not? The study says benefits unproven. You were familiar with this as well, Dr. Amma.
Yeah, James, I'm proud of you. He's obviously an avid reader and he's on top of things. Yes, there is one study, a single study in the history of studies that we've done for years that have proven the health benefits of multiple, actually, health benefits of flossing. There is one study that recently came out. It hasn't been backed up really with any follow-up studies, and any subject in medicine. When we do a study, we don't stick to one study result unless it's backed up with because the studies have certain ways that can research the same topic and come with completely different outcomes. But the consistent outcome historically throughout the research of oral hygiene and the direct impact on general human health is please floss. If you choose to stick to one study that's not really been backed up and not really have been verified with a lot of authorities in the medicine and dental world, it's your choice. But our professional advice is stick to your floss, please.
Yeah, well, it says here, according to the American Dental Association, ADA, they are vigorously defending flossing, say it is an essential part of taking care of your teeth and gums. The Associated Press state here, the studies backing up the ADA's claims are outdated and only surveyed a small number of people. Evaluations of the other studies conducted in the past 10 years found evidence for flossing. So, you know, it's an interesting one here. But you know what, Dr. Amma, the more you read into it, there are other studies suggesting that it's unreliable, that flossing isn't necessarily all it's meant to be.
When the latest one is the largest of them, and we always consider the number of subjects that were included and the methodology that we follow in proving results in a study. And as I said, it's he said, she said, somebody read something. But as the documented studies that we are all following and recommending is to please floss and brush.
Coming back to this question about the person with toothache, saying that the dentist has suggested I have a root canal, but I was put on antibiotics and the pain has stopped. Do I still need to have the root canal?
Please go ahead and have your root canal done. Antibiotics are just an intermediate stage of the treatment to control the infection and localize it. So when the dentist goes and cleans the root canals out, he can thoroughly go and hit the focus of the infection. But the symptom of pain, once it's gone, that does not mean that the treatment has been done. You need to finish the treatment, please.
Okay. And with root canals these days, it's almost psychological a little bit, the idea of it.
And
you sort of create in your mind this visual of somebody, drilling down into your gums, into the bone, but that isn't what's happening.
This is history, and if you have a good, up-to-date dentist, root canals are completely painless. I know it's notorious, and of course I hear that every day, but people that go through it, they come out and say, hey, I don't know why I was getting myself all worked up. It's completely painless.
James has come back and said thanks about the flossing, explaining that, but I hate flossing. Any tips to make it less annoying and painful?
Use the water pick.
Okay.
If you don't like the tape or the thread, there's something called water pick that is doing the job of a floss. We're using a jet stream of water.
What do you mean? You can buy that over the counter?
Yeah, you can buy it over the counter anywhere. It's called water pick.
Sorry, so why is that better? So first off,
it's not better. It's replacement of the manual floss. If he hates, he says he's hating flossing.
Yeah.
So if he hates it, he can use the water pick.
All right, but why is that better than flossing? What I'm getting at, I don't know what James, but what is it that's annoying about flossing?
I have no. It's his personal. he just doesn't like flossing. He just said that. So
how does it work with the water then?
The water pick it looks like the electric toothbrush.
Right.
And it just shoots a very strong stream of oxygenated water in between the teeth where the floss goes. And it flosses with water instead of having the thread go in between the teeth. This is the alternative of the regular flossing. It does the same. It's not better. It's not worse. It just does the same job. It's a little bit more expensive, but it does the same job for people who don't like the regular flossing.
Kim's asking about mouthwash. What would you recommend, therefore, and should you be using a mouthwash every day?
Very good question, Kim. Kim, the best and the cheapest mouthwash is the salty water. Just room temperature salt and water. And do we have to mouthwash with the salty water every day? Once a day is more than enough. It makes all the media inside our mouth and around the teeth go and normalize. If you like a certain taste or a smell that you use a commercially available mouthwash for, go ahead. It doesn't really do any harm apart from just having a fresher mouth if you wanted to. But if we're talking about the medical and physiological effect, salt and water is the best.
Okay. Lots of people texting in with their questions. When it comes to checkups for my 3-year-old, what do you recommend for children, Dr. Amar? So when a little one, toddlers, when do you first go to the dentist and how often?
The first visit of a toddler needs to be with one of the parents, and the parent should be doing the examination, not the child. And I always advise people with this. Tag your child along, come have your own consultation in the presence of the child. Let him see and get familiarized with the dental layout and see that it's not a big deal at all. And then we can talk the child into sitting on the chair and opening the mouth. And we make it a lot of fun. We make it a lot of exploration and inquisitive time for them. So their first experience is very important. Try to start from 2 years onwards.
Back again on the flossing and cleaning of teeth, and somebody's asking about bad breath, and that they'd read somewhere that you can tell health conditions based on the type of odour from the mouth. So what can you add there, Dr. Amma? What would be considering if you have an odour, a bad breath?
Yeah, bad breath is a multi-sided problem. It's a sign of a systemic body ailment. It could be localized only to the mouth or coming from the digestive system or the sinuses. We cannot really tell based on odor, but we can tell based on swab and identifying the bacteria. Bad breath comes from a bacteria that's residing in between the teeth and the gums. So with a simple swab, we can tell which kind of bacteria, and we can combat this and eradicate it. We can't really tell by the kind of smell, but we can tell by the kind of bacteria, yes.
And I suppose if you think that you have good hygiene, but you have an odour, then that might be something you want to check out.
Of course. And as I said, it's a sign of a systemic infection somewhere, whether it's in the digestive system or in the sinuses or locally within the throat and mouth.
Dr. Amma's here from the Dental Spa. He's a cosmetic, laser and family dentist. And we're going to the phone lines now. We've got Melanie on the line. Good morning to you, Melanie.
Good morning. Can you hear me okay?
I can.
Quite a busy road.
Oh, no, we can indeed, Melanie. Tell me, what's your question for Dr. Amma?
Okay, it's a little bit of involved story. I'm now 45, and when I was 25, I had a car accident, which involved me, all sorts of things happened, but I lost one of my front teeth. So I had to have root canal done and a crown put on. It got infected, which I think happened quite a lot back then. So they took it off, cleaned it out, put it back in again. I then went around with the rest of my life, and I moved to Dubai. And actually, probably about 7 or 8 years ago, I went into the dental spa, and I think the doctor said to me, "Goodness me, Melanie, your tooth, your root canal, has not been refilled when they took it off." And I thought, really? I had that done at Harley Street, and I found it hard to believe. Went away, carried on with life, and it has a low-grade infection, which I've had for a long time. I then subsequently bit down badly on a fork, and that tooth is now only half the width that it used to be. It still looks fabulous, but it's only half the width, so it's going to go. One day it's going to disappear. Now, my fear is, having had an implant in another tooth before, for another totally different reason, it's incredibly painful and tricky to have an implant done at the front. So I'm worried really about, or my question is really, should I wait for the tooth to just break eventually, or should I have somebody remove it and then start the process? Because I've heard it involves bone graft, it's incredibly painful, it doesn't look the same, and I'm just nervous of what to do. Should I force the issue now, or shall I wait for nature to take its course?
Dr. Amma.
Hi, Melanie, how are you?
Hi.
I'm going to make this very simple and straightforward for you. The persisting infection within your bones, as you mentioned, that eats away the bones around what's remaining of your roots.
Yeah.
And that makes it very difficult for the natural tooth to be stable in place, or any other surgical option as in implants. So what I'm trying to say is, sooner is the better.
Okay.
Do not wait to lose more of your natural bones. You may or may not need bone grafts. I haven't seen you, and we haven't had the proper examinations. But from the story that you're telling me, you may need an implant or other options. It's not either ways. Pain now is not on the table. Please do not scare yourself and think that the pain justifies losing bones and losing teeth. There is no pain in the modern dentistry nowadays. There is zero pain. If you see professionals that are up to date on what they do, they save your teeth or give you the alternative painlessly.
Right, okay. The implant I had was very, very painful. It was just a baby tooth. I'd never had an adult tooth underneath it, so eventually I had to have an implant. And it was incredibly painful.
Well, of course, listen, nobody likes pain. If I had something painful, of course, me, myself, I would not go for seconds. But as I said, it's things have completely changed, and maybe you had an unfortunate choice of provider.
Yes, perhaps.
But as I said, nowadays, and I'm telling you this as a fact, dental treatments are completely painless.
And why is that, Dr. Amma? How has the pain side of procedures been taken away?
Because that one, of course, the expertise of the professional. Two is the technology behind it. We use lasers and we use anesthetics that are really, really potent as well if we needed to. If in the case of lasers, we don't really need to use any anesthetic at all. But if some cases cannot be done by laser, we use anesthetics. So
and that's a local anesthetic.
Local anesthetic in the area, yes.
Yeah.
Not general, just local in the area. And the mixture of expertise plus technology makes things extremely straightforward, easy, simple, and completely painless.
I hope that reassures you, Melanie.
It does. I suppose the other question is that I would love to have had my teeth perhaps whitened, but I can't because I have a crown there right at the front. So that would be a question I suppose I can only have done at that time, or can I have my teeth whitened while still having the crown?
Of course you can have your teeth whitened while you're having a crown, but you might end up with a slight difference in shade, because whitening only works on natural teeth.
That's right.
But you do, when you're having a crown, try and match that the tone and colour of the natural teeth, don't you, with the crown? The crown matches the teeth.
Originally, yes,
as much as you can.
Yes, but with whitening, her teeth might go brighter than the time it was the crown was made.
Yeah.
So usually, what we do is we do the whitening first, and then do any prosthetic as a crown.
Yeah, if you're having a new crown, then you could brighten it. Yeah. All right, Melanie, we wish you all the best with that.
You're welcome.
You're
welcome.
Yeah, you take care. All the best. It's interesting. It's a really good call actually, because other people are asking, like for example, with a root canal. Is it the same answer, Dr. Amma?
Yes, it is.
How is it? How is it that it's no longer painful, but it is down to the technology and the practice?
The expertise and definitely the technology nowadays. And if you have a doctor that's on the cutting edge front of things nowadays, dentistry is very simple. One of the things that we do is laser. And 3D printing, as we mentioned earlier, makes things very fast, simple, and completely painless.
Well, it's a good time to be going to the dentist then, I think, because it's never been a favourite thing of mine, a thing to do. But now there's lots of messages coming in. One here from Christina. I have a crown on my tooth. How much protection do I get from food getting inside it? Let's address that one first.
If the crown done properly, you have no food that goes under it. The crown is like skin over your tooth. There's no space for anything to go, including bacteria even, should not be underneath a crown if it's done properly. If it's one of these old metal crowns, they expand and shrink with thermal change inside the mouth, and that might create something called what we call percolation, which is flow of liquids underneath the crown, allowing bacteria and other stuff to go underneath it, which is very, very old and shouldn't be there anyways. But if the crown is made properly, nothing should go underneath it, so you shouldn't worry about it.
She also asks that she says that she has 2 metal fillings and I want to remove them. What are the risks? Now, I'm not sure what she means by what potential risks there might be, but what do you think?
Some people, again, it's the same school of flossing or not flossing. Some people think that removing metal fillings could be worse than keeping them in place because of the content of the metal filling of the tin and the mercury. But again, with the right kind of practice and equipment, there is a immediate suction and evacuation of all the debris and the parts of the old filling that we remove that does not touch the oral cavity at all. It goes outside through the suction systems. and allow us to restore the tooth without metal. But the fact is, lose any metal filling from inside the mouth. This is the healthiest thing that you can do to yourself. There's a lot of issues, including arthritis and unexplained allergies that are directly related to metal fillings.
Fascinating.
And there's not only one study for that, there are a lot of studies for that. But yes, the worry about the material of the metal filling being ingested is, if you're seeing the right people, it should not be a worry at all, because it's handled with care.
Coming back on the mouth rinse, mouth wash, you were saying that, probably the best thing to do is to use salt water to rinse the mouth. And Christina's saying, I just heard about salt. After washing with the salt water, should you then wash again with just water to wash away the salt?
If you would like to, but when I say use salty water, it shouldn't be really, really salty. Like if we have a glass of water, you use half of a teaspoon of salt on it. You shouldn't really worry about this amount of salt, and it's what we call a physiological solution. It's good to be in there. But if you would like to rinse afterwards, just for taste or personal choice, go ahead.
Someone here is talking about a certain brand of toothpaste. Now, I don't know if I can communicate this with you, Dr. Amr, but basically, I find that this sensitive toothpaste desensitizes my teeth and gums. Why would it be half price, half of all the other brands which have chemicals? So he's looking at a natural brand of toothpaste. He finds that it desensitizes the teeth and gums. Why would this be half the price of the other toothpastes?
Okay, let me have a different spin on this question. Why do you need to desensitize your gums and teeth? The issue is not really with toothpaste. I would be worried about the main cause for sensitivity. If you do have sensitive gums or teeth, that means that there is an issue. So please go and consult your dentist and figure out why, to begin, you shouldn't be having sensitive teeth and gums. So don't mask it with a toothpaste, whatever the toothpaste is. Find out why you have sensitivity, because it's a sign of a bigger problem.
Right. If it is, do you consider that when it comes to toothpaste, though, like we do with many things today? We want to get as natural as we can. We don't want to put chemicals inside our body or on our body. Is there anything you should be aware of when it comes to chemical toothpaste? What should be in a toothpaste?
I want to put the minds of the listeners to ease here. There's no products, especially in UAE, there's no products on the shelf that hasn't been thoroughly licensed and thoroughly traced for safety and health benefits. Nothing is going to be bad on the shelf when it comes to toothpastes. It's just a personal choice for taste and smell and kind of toothpaste. But whatever toothpaste you're using, it is not damaging to you at all.
When we come back, we'll address this text from Mark regarding his 7-year-old little boy has no enamel on his back teeth. There's a bit of a story alongside this, so we'll address that. Dr. Amr, if we're looking at our messages coming in, one here from Mark. My little 7-year-old boy has no enamel on his back teeth. The dentist said that this is common here, and he's had to have 3 fillings in his back adult teeth. Please could you explain why this might be? He did have very strong antibiotics when he was a small baby, and I've heard that there might be a link.
I really don't know why the dentist says it's common here. It shouldn't be common, but I understand if your child has been exposed to antibiotics. That makes the teeth look different and darker, but it does not make the teeth without enamel at the back. From the description, it's either your child is a grinder, and it's very common in kids at that age that they grind while they sleep, and you need to keep an eye on them and see if this is the case, or they have or they are used to eat some foods that are enamel anti-enamel eroding in the enamel, as in chewing on citrus fruits and mints and candy and stuff. But I really would like to see the child to give you because that it could be a number of things. I cannot tell him specifically what is the reason for that till I see and investigate, but it could be for a number of things. As I said, it could be food, mints, or it could be that the child is grinding. But it could be corrected easy, as I said, and we can add an artificial layer of enamel where there is no enamel at the back.
Okay.
I would be interested as well to know how did he notice that there's no enamel at the back teeth.
Right.
Is the child complaining? We need to know what's like. It's a good question, but it needs to be investigated properly.
Or whether it's just picked up in a checkup.
Yeah.
Okay, good. Thanks for that. And when it comes to looking into the long-range weather forecast, if you will, of our lives, looking here from Oral Health Foundation, tooth loss can be used as a major predictor to somebody's life expectancy, according to research. So more research here for you. It's the research published at the Periodontology 2000 found that the number of teeth we lose can be a key indicator to our quality of life, and that those who have a full set of teeth when they're 74 are significantly more likely to reach 100 years of age. The study shows that there was clear evidence that tooth loss is closely related to stress during a person's lifetime. This includes a person's specific social, emotional, economical and educational experiences, as well as health issues such as chronic disease, genetic conditions, nutritional intake and lifestyle choices. Now, I talk about stress a lot on this show, on the health show, on the psychology show. I would never have realised there could be a connection to the health of your teeth as well. So what do you say, Dr. Amar?
This study has been out for a while, and I completely agree with it as well. And it's something that we see on everyday basis. People trying to have a laugh and immediately covering their mouth. Sitting in a restaurant and trying to keep their lips together while they are chewing, avoiding certain foods because they cannot bite into it. And that on its own causes stress, and it's a vicious circle. Teeth are in place with a very intricate system of bones, ligaments, and gums around them. And these are what we call mirrors of the general health. If I'm stressed, or if I have a certain infection somewhere in my body, or diabetes, or kidney problem, or I'm on a certain drug for epilepsy or seizures, that have major impact on the supporting dental system, the bones and the ligaments that keeps the teeth in place. And they get loose and we lose the teeth, and that adds more to our immune system and our stress levels, and vice versa. If we have an accident, let's say sports accident, and we lost a tooth, we get stressed, which causes stress that would deposit in one of the other body organs and start having blood pressure. So we are one linked machine that everything impacts on everything else inside the body, including the teeth, of course.
Dr. Amar, we are out of time. Thank you so much for your time today. You can connect with Dr. Amar. He's a cosmetic laser and family dentist based at the Dental Spa on the Beach Road. We've posted up his details as well on our blog post today at DubaiEye1038.com/Dubai Today. Until the next checkup, Dr. Amar, thank you very, very much.
Thank you for having me today.
Thank you so much. Now, Arab Health is running this week, bringing together local and international health practitioners. Producer Joe caught up with Dave Panther, Vice President of Global Sales Life Sciences at Informa Middle East, the organisers of Arab Health, to give us an overview of the global health event and what to expect when it comes to health developments and innovation.
Arab Health is the region's largest healthcare exhibition. I think also the second largest medical exhibition globally. We run annually in Dubai. This year we've got 4,400 companies coming from just over 70 countries. And we also are running a number of multiple healthcare conferences with accreditation, so the doctors and the nurses can keep up to date with all the latest trends in healthcare, the future technologies and innovations that are going to be coming in so that they can help to treat the patients better, make sure there's better patient outcomes, and ultimately improve healthcare across the region. We've got a mixture of clinical programs and also some healthcare management programs. So each year we try to have a theme for Arab Health, and this year it's on automation and innovation in technologies. So we'll be closing the event on Thursday with our flagship conference, which is under the patronage of Her Royal Highness Princess Haya, which is looking at the leaders in healthcare, and that's looking at all these innovations. One of the main innovations which seems to be coming out on the exhibitors and also the conferences is the advances in 3D printing, the use of robotics for various elements of treatment of patients and also diagnostics. Then we're also looking at some of our conferences at more speciality levels. So we've got a pediatrics conference, a surgical program, oncology, urology. So all the specialists in that area can hear from speakers from around the world and obviously around the region and locally about what different treatment methods are coming in to be able to apply them in the hospital environment.
And I understand you've also got the likes of Médecins Sans Frontières over here as well.
Yeah, I mean, obviously it's great to have them here, and they're also conducting some workshops on sort of innovations in disaster management and handling crisis. So they're bringing some of their real-life experiences that they've been engaged with across the region. So that's also very good for people to be brought up to date with the changes in that disaster management as well. Yesterday was a great day. We had the opening at 10 o'clock. The buzz around the show has been fantastic. The biggest change this year is we've actually been able to separate one of the specialist zones of Arab Health, which is our medical laboratory show. So normally it runs side by side, but the growth of both Arab Health and the medical laboratory industry has enabled us to run MedLab as a standalone show next week. So we're here until Thursday for Arab Health, but then on next Monday on the 6th, we'll be opening for the medical laboratory. So that's something that the growth of the healthcare investment in the healthcare industry has enabled us to do.
Exciting times indeed for the health industry here in the United Arab Emirates. Talking there to Dave Panther. Producer Joe caught up with him earlier. Vice President of Global